Hi, everybody. Welcome to We Gotta Talk. I am so excited today. I feel professional for the first time in months. I've been recording in my closet, which, you know, we love an organizational moment. But today I'm recording in studio with a really special guest and someone that I have gotten to know personally over the past couple of months and who's really helping me feel better. And, you know, I don't keep secrets when it comes to what I'm doing to feel good. And I'm coming up on birthday number 44. And the upkeep is real. So today's guest is here to share all sorts of tips and secrets on keeping your body healthy, but also your mind too. I have Jasmin Stevens, who is the founder of LymphWoRx, which if I get this wrong, Jasmin, please correct me, like live happening now, a boutique lymphatic treatment.
It's like a luxury lymphatic
studio. Okay. And we're in Orlando, so it's based in Winter Park, Florida. But she's on social media and you've been doing this for a long time.
Yes.
I've been seeing you for several months now. And as soon as I started to go to you, everyone, including my own sister, was like, oh my God, Jasmin, I've been seeing her for years. I'm like, why was everybody gatekeeping Jasmin?
They don't want to tell the good secrets.
You're a legend. And I mean, I'm telling you, like, I hear from a lot of people locally on like, what's good or like where to go. I cannot tell you how many people are like, oh yeah, I've been going. I'm like, where have I been?
It's like all the Winter Park ladies.
All the Central Florida girlies are driving to you. There are so many questions about what a good lymphatic treatment really is and like what it looks like. And we're going to get to that.
Okay.
But I really want to highlight your backstory and background first.
Okay.
Because the wellness space is crowded. And I do think that rightfully people are all trying to sort of make their mark. But what you do is a little bit different and you have a medical background in this as well. So tell everybody a little bit about where you started and like how you ended up here.
So again, guys, hi, I'm Jasmin, the founder of LymphWoRx. So this all began, I have a bachelor's of science, health science from the Florida A&M University in Tallahassee. It's an HBCU.
Historically Black college or university.
Yes, ma'am. Yes. Okay.
A journalist in me.
Okay. So I went there for undergrad. And then from there, I transitioned and went and got my master's in occupational therapy. So graduated 2015, had my daughter and everything like that, my 8-year-old. And then 2017, I started working in the OT space. So I literally worked every setting. Like I did outpatient, I did inpatient, I did trauma hospital, I did acute, I did ALFs, ILFs, like skilled nursing homes, like literally pediatric outpatient facilities, home health pediatrics.
Right.
Every setting an OT can work.
And when you say OT, occupational therapist, you're like, you're manipulating the body like to like learn how to move again after an accident? Like what does that actually look like? Because some people might not have done OT.
Okay, so basically OT is more so like upper body. So I say that, but then it's like if you're in a kid space in peds, if you're like in a school, you may do like sensory and like autistic kids, Down syndrome. If you're in inpatient rehab, you may see someone that had a hip replacement, a knee replacement. If you're in trauma, you see some people that are having gunshot wounds that are in a coma.
You're helping them learn how to move again.
Yeah, making splints. Like, it goes deep. So you just, depends on what setting is what you do.
So you know how mechanically the body works because of that. You're not just doing this and you're like, oh, that's an ache. Because, you know what the inner workings
the inner work, the anatomy and physiology, how the body works, like the mind, body, soul connection. It all goes together.
I can't wait to talk about that. The energetic side of it too, right?
So I did all that. And then I was introduced to lymphatic drainage, lymphedema in a skilled nursing home. So like, some years ago, it was like oversaturated in Orlando with like OTs and PTs. So it's kind of hard to get like a good job. So everyone was like, oh, get certification. So me, I'm like, okay, we'll do that. So I was in a nursing home and this guy was like doing this rapping on this man who had lymphedema. So my younger self, I was like, oh my God, like, what are you doing? He's like, oh, I'm doing compression wrapping for, this person that has lymphedema. You should like look into the certification. So I was like, okay, like, he's like, it makes money. So I was like, okay, younger, like, okay, it makes money. That's cool.
Oh yeah.
So I looked into it and kind of like did like the background research. But in the nursing home, I never really wanted to do like medical. I was like thinking of it like, okay, I can get the certification and then maybe do like women for like post-op, like hips, knees, cosmetic surgeries, etc. So I went to Las Vegas. Well, I signed up, went to Las Vegas for like 12, 13 days and did the certification for the lymphedema therapy. And it was through VODR, like Norton School of Lymphatic Therapy. So they taught us the VODR technique. So did all the coursework, all of that stuff, took the test, passed it, and then became like a certified lymphedema therapist. So that was back in like 2018.
Okay.
So then my whole thing was to like kind of like start like the whole post-surgery, but I was just like, oh, I'm kind of scared, you know. But during the time when I was doing the certification in Las Vegas, as I was researching the lymphatic system and like seeing like the responsibilities, like what it does, like who benefits and all these things, my questions were always like, okay, well, if we can treat people that have like lymphedema and all those kind of diagnoses with lymphatic drainage, with compression, and with range of motion exercises, how can we prevent those things from happening? Because everything is coming from your lymphatic system. So how can we like prevent it?
Right.
So when I had that mindset, the lady in the class was just like, Jasmin, like, no one really cares. Like, insurance won't pay for that.
She hasn't been to Winter Park, Florida.
Yeah. She was like, no one will pay for that. So I was like, okay, you know what? She's probably right or whatever. So it was like in my head, but it was like kind of like out.
No.
So some years passed and I was just like, you know what? Like, I don't really care to do this like how I'm doing it, like the medical standpoint.
Like reactive, not preventive.
Yeah.
Right.
So I'm just like, all these people are sick and I'm treating all these sick people that are going to have these conditions for the rest of their lives.
Right.
You know, like, yeah, they're, you know, keeping them like at bay with the lymphatic drainage and wearing their compression garments and all these things. But like, how can you just really prevent these things? Like, I want to like prevent. So when was it? It was like, what are we in 2025? It was 2021. I started doing like mainly like just post-op. So I was going down to Miami. I was working as an OT still full time. And then after COVID, and then I was going to Miami doing like a lot of surgery clients. So like after like breast augmentations, tummy tucks, lipo, all that kinds of stuff. And then I was doing that and I'm just like, I don't feel fulfilled. Like it still was just like people weren't really caring about their internal health. It was like I was going to do this surgery for a quick fix. And I want to do my lymphatic drainage because I know that it goes hand in hand, but I still want to eat horrible. I still want to drink all the alcohol and I don't want to compress and I barely want to get lymphatic drainage. So I was just like, yeah, I can't do this. So it was literally like where I live, there was like a salon suites like next door to my community. So I literally like they had one open and I just said, you know what, I'm just going to go ahead and if the space is open, I'll rent it out and I'm just going to start there and I'll start marketing myself as like wellness and I'll just put it out. And if whoever wants to come, they'll just come.
Did it just blow up right away?
So it wasn't right away. So basically I got the space and my friend Shelby actually, she's like into like the whole like bodybuilding, sculpting, you know, all that.
Right. The competitive kind of stuff?
Yeah.
Right.
So she was like one of my first clients for like health and wellness. So basically she came and I did her whole lymphatic drainage.
Did it like make her look more cut for the...
Yeah. So I was at first, I was like intimidated. I was like, oh my gosh, Shelby girl, like you look good already. Like, I don't know if this is gonna make a big difference, you know? And she's like, Jasmin, like, don't be silly. So like, I literally did hers and I like heard all the movement. I heard all the like noises and I'm like, oh my gosh. And then after she was just like so much more like.
Was it leaned out looking?
Yeah, leaned out. Her like muscles were so like everything was so defined. Her abs, like it just was crazy. And I was like, oh, okay.
So I'm going to just hop really quickly in with this question, then I want to get back to your story. But what is happening when we see that? Because your page is so great with showing before and after pictures. And you're like, the angle is consistent in the lighting. Like the TV person in me is like, oh, these before, they're so good and consistent. But that's kind of your trademark is you do show the before and after and you do even normal people like me who's not whatever, like you can see the difference. So what is happening in the body when we're coming out and we're seeing just a little more definition after these?
So I'm basically just showing. So for me, honestly, the before and afters is just like a quicker way for me to kind of like put something on social media. I never really explain what's going on, but just like to put it out there. So basically, I kind of show the stomach area only because I feel like as women, we house so much in our guts that like it's crazy, right? So when I have the before and after, it's mainly because during the lymphatic drainage session, you're activating like your deeper lymphatic system. So I'm kind of like moving a lot of things that are like stagnant in your gut. And then so when you're done, you kind of like see like maybe like, hey, I wasn't quote unquote fat. I didn't just have a lot of weight that I needed to lose. It was literally just inflammation.
Where is it located in the body? I envision when we do this, we always hit a little pool of something on my, like between my upper, like on my upper stomach, kind of on my ribs.
Yeah.
Help us visualize like what what is it? Is it a little pool of liquid? Is it little pockets? Like, what are you moving around in there?
It could be pockets. It could be a whole pool. It's just like whatever's like congested, like deep in, like in your body. Like it could be, I've heard and I felt like pockets. I felt like
Right.
little bubbles that felt like little popcorn. I felt
Is it stuff our muscles are releasing, like a lactic
just your
acid
body.
buildup?
So
What
it
is
could be lactic acid. If your lymph system isn't running correctly, it could be that you work out a lot and your lactic acid is built up.
Right.
It's not like coming out of your body correctly. It could be just like the toxins and waste and fluid that's supposed to expel from your lymph system is just getting trapped in your body.
What is like lymphatic waste, so to speak? Like, what is that?
Literally, it's just waste. It's honestly, whatever.
It's
like,
just like
whatever
the
your
stuff
body's
the cells
housing.
isn't using.
Yeah,
cells
whatever
aren't using.
Whatever your
Okay.
body's just like housing. Just like the waste, the buildup, because all of it is meant to filter out through your lymphatic system.
Mhm.
But like I said before, like, well, that, depending on what you eat, what you
Right.
drink, your environment, things like that, the waste just gets built up in your body if your lymph system isn't working
Mhm.
optimally.
And most people aren't like challenging their lymphs, to use a term, system on a regular basis. They're not activating it. They're not, I mean, we may be working out, but that's not the same, is what I'm
No.
hearing you say, as activating that system and helping it flush out. It's kind of like the custodian of your, like, work out the muscles, but like everything around there, you got to kind of clean up too. Yeah.
Sometimes you need like a little bit more work.
Okay.
Just depends on like what you have going on in your body, because it could work for you, for 30 years. But then if you have a high period of like stress, or if you went through a trauma, or like just something, like it just compromises your lymph flow. Surgery
is a high cortisol level related to like improper lymph function? Like, if people are really stressed and they have those high cortisol levels all the time, do they tend to be more inflamed based on what you see?
Yeah, because when your cortisol is high, your body's in a fight or flight mode. And then when your cortisol levels are high too, it causes way more inflammation in your body. So I wouldn't say like it just completely like just like compromises your lymph, but your body is in a fight or flight, and it's not like in that rest phase where it can just relax and just flow. So you're very tense, you're uptight, and your body houses way more inflammation. So if your lymphatic system isn't working properly,
Right.
your body's just inflamed, and it's just sitting on you.
Holding on to all of that. How many lymph centers are in the body, and where are they?
There's about 6, and there's 600 lymph nodes in your body, give or take. And so you have like your cervical nodes, your clavicle nodes.
Will you point to like the ones that we can see?
So cervical nodes, like in your neck, you have your clavicle nodes.
Down here, like collarbone.
You have your axillary nodes.
Under the armpit.
You have your inguinal nodes.
Groin.
You have your popliteal nodes
behind
under your knee.
Okay.
And then you have deep within your rib cage called the sternocleidomastoid. And that's houses
my
like
bad
lymph
boy.
nodes.
That's where that's where like the pool of like waste is. What is it called again?
It's a sternocleidomastoid.
And
my one client calls it her Kylie Jenner. You know who you are if you see this.
Oh my gosh, that's so
She's
funny.
like, drain my Kylie Jenner. I'm like,
my Kylie is misbehaving lately. We push on my Kylie, and I'm like, it sounds like it's like a burbling stream. I'm like, what the heck is going on? What does that mean? It just, again, that I'm like holding on, and that happens to be the spot.
Because a lot of times, like if things are trying to like move, because the lymph system runs from your feet back towards your heart.
Yes. Okay.
So if things get stagnant and they can't move up, and they're not like able to move past to go back to your axillary nodes,
right,
then they just get trapped. So sometimes it could be in that area here. I mean, sometimes I have people that just house a lot in their legs, depending on like what they do or like what's going on in their body.
After it's released or physically manipulated through this therapy, where does it go?
It drains like towards like, so it drains out in urine, bowel, and sweat. Wow. Yeah.
I did feel kind of sick after one treatment, like not like throw up sick, but I felt like my body was finishing the purge of, and then I felt much better afterward.
You'll get like maybe like sluggish feelings. Sometimes you get a headache. Sometimes if your body's like housing, like if you were sick prior to doing the treatment and your body has like extra bacteria that it was housing, it's going to be coming out through your lymph system.
Right.
So it's going to be expelling out. And so you may feel like a low-grade fever, like flu-like symptoms.
Wow. Yeah. Okay, so there's a lot of debate about this, and maybe not debate, maybe discussion in the online wellness community about what constitutes a good lymphatic treatment. Some people are huge proponents of the light touch. Some people, I know some places that even use tools or instruments to like really dig deep. So you have these two extremes. Tell us your philosophy on what good lymph treatment looks like, because you do have a medical background, which I feel like sets you apart.
So honestly, if I'm being honest, I feel like a good lymph treatment just starts with the therapist. So
Mm.
I'm really just big on like science-based, like research, proven, things like that. And just like having a good like knowledge, like your background. So I believe that like it starts first with who you're seeing. So when people want to get lymphatic drainage, even if it's not for me or someone that I know or like in the same space, just mainly just ask questions like, okay, so like where did you go to school? Like what licensing do you have? Because there's a lot of people now that are like, like looking at YouTube videos and like coming back and saying, oh, I do lymphatic drainage because I watched a YouTube video. And you I don't knock anyone however they're doing their business, but it just starts with a therapist. I feel like I believe in like just being real, like having integrity, like making sure that I'm doing the safest thing possible for my clients. And I feel like being knowledgeable, they just feel safe. You know what I mean? Like, like how this treatment is going to affect this person, if they have autoimmune, if they're pregnant, if they're post, from cancer, if they have lymph nodes removed, if they have swelling from like a flare up from, I don't know, like a fall or something.
Right.
Like you just know how to like adjust and like how to treat the body based off the different diagnoses. So it just starts with like the therapist first. Like make sure they have a good background. Just don't go to someone that says, "Oh, I was training one day and I do lymphatic." Like ask the question like, how are you certified? Like what's your background? Do you have like, did you go to Norton School Lymphatic Therapy? Did you go to ACOS? Like, there's two or three different schools that like will train you to be a CLT or
Which is a what?
have
Certified
a certified lymphedema therapist
lymphedema
or
therapist.
a manual lymphatic drainage therapist that's certified. So some people can't get the full CLT because they don't have like a certain degree. So like I'm an occupational therapist, so I became a certified lymphedema therapist.
Wow.
But if you're like I don't know, maybe a massage therapist, I'm not sure if you can't get the full CLT. You can get like the manual lymphatic drainage certification, like MLDC certified. And that way you're in the database and you're able to perform that. So just make sure that they have a good background. And then also I feel like the number one research base that shows how to treat your lymph system is manual lymphatic drainage only. It's hands. It's not wood tools. It's not these machines. It's not like all the fancy stuff. Like some people see like, oh, this person's using machines or this person's using tools. Like it's more legit. That doesn't mean that. It could be people say they do add-ons, right? I believe that a person that does a lot of machines and they're saying that it's lymphatic drainage means that they just can't use their hands.
Your hands are intelligent too. It's like a doctor's hands after time.
It's,
you begin, or a piano player, like there is intelligence in that like body knowledge. So I believe that to hear it. And the way that you can manipulate with 5 fingers versus a wooden plank or something, I have seen the benefits, and I have kind of, and again, I'm like not knocking anyone here, but to experience someone whose hands are smart versus just pure like massage technique, I do think you can tell a difference. And you can probably feel things as you go too, so that you can adjust accordingly.
For sure.
Yeah. And is there anything to the light touch versus more intense pressure? And do you have a preference, or do you customize as you go?
I feel like I customize as I go. So because I am trained from the Botter technique from Norton Lymphatic, the school lymphatic therapy. And then also I have a mentor that's from Brazil. So they focus on more the deeper lymphatics because in Brazil, they use lymphatic drainage as a form of medicine. So here we just use medications.
Sure do.
Brazil is like, okay, out of the womb, a couple months old, the baby's getting lymphatic drainage. And I mean, for my 4-year-old, I started using it on her a little bit early too because she was born during COVID and she had like a lot of different like just always on an antibiotic because she was sick. And her gut, she had like a lot of gut issues. So I would do lymphatic drainage on her and then my oldest daughter as well. And even like now, like my youngest client, like I have one in Tallahassee, she's 4 years old. And then I have a 10-year-old. And then I have like, now I'm kind of getting like a little bit more high schoolers who's maybe parents come to me that say, oh my gosh, my kid has acne or my kid has a horrible diet or like my kid's stressed out or they do all these sports and their body's super fatigued. Like,
right. And
so
it helps with all of that. Wow.
So, yeah.
Yeah. Okay. I'm glad we talked about that. I do think you're right. Like in the age where information is so easily accessible, and I do think people kind of put on the expert hat a little prematurely.
Too much.
Yeah, a little too much in a lot of fields and spaces. That is helpful because I think if you see like a great social media page, you're like, oh, well, they must be legit. But knowing what to ask for specifically about the certifications is really helpful.
Certificate, and don't be afraid. I feel like some people are like, oh, I don't want to ask, but especially if like you're paying your
Right.
money, you want to make sure, because even in the beginning when I first started, my prices were a lot, like not a lot, but they were on the lower end.
Right.
And I've had clients that said, oh, I thought you were catfish because your price was so low because, you know, maybe I went to California or New York and I got this service done, and the provider, maybe it was $350, $400. And because your price was nowhere near that, I didn't think I was going to get what I got. But then when they came, they're like, I got way more than what I was getting before.
That's amazing.
So it's just more so, I feel like me, for a while, I invested so much money into like just knowledge. Because I feel like money's not everything. For me, it's like if you're in this space, you really want to, you're in here because you really want to be in this space, right? So you have to like educate yourself. You have to like put money back into yourself and like your knowledge, because it goes so deep. So you might have a client that comes in with something that you don't even know anything about. You want to have to like, you have to go like want to be able to research and like kind of like understand the correlation between the lymph system and whatever they're coming in, because they're going to come in again.
Well, you told me crazy stories too about finding or discovering that people were dealing with medical issues, not as a diagnosis. I want to be clear about that, but sort of understanding what was happening with people's bodies before they did. Can you share some of those examples with us? And I mean, I have to do this because people are like, this is not doctor's advice. Please see your own doctor.
Please.
You know, I feel like I have to say that because people are like, well, I heard on a podcast. But do share that, because I think there is a lot of value that you can bring to people with that. So
yeah, so I feel like just like taking the time, like, I mean, understanding the body and like knowing the body, right? So it's clients that I've seen for, it could have been like months. So
extended
like, I don't
period. So you
remember,
knew what their baseline was.
yeah.
Okay.
And I mean, I have the pics in there, like, you know, in their files and stuff like that. So it's more so just like, I like, don't remember names a lot, but I remember bodies. Like I know the body. So like just even one client came and like, she was just always so bloated. And I'm like, why are you always so bloated? Like you literally come every week. What is going on?
Right.
And then so I was kind of like doing her lymphatic drainage, and just like her gut was just like always just so bloated. And she's like, and I was like, you need to go check on this. And then after like 2 sessions of me telling her, she's like, I'm going to go ahead and check. Well, then she just found out like, well, she had found out at the time that she had like fatty liver. So she had to start like taking like more supplements and things like that. But it was just like something that came up, you know?
And you noticed the change. There was something about like someone's neck. Oh, she shared
the lady that had the maybe the swelling in the upper body.
Yes.
So like she was super swollen in the upper body. So me being like on my CLT vibes, I'm like, maybe like, do you have any like high blood pressure or anything that's causing maybe like your flow is not how it needs to be? And she's like, no, I don't. And I was like, maybe you should go, because she goes to functional medicine. I was like, maybe you should ask your doctor for like more extensive, like maybe like labs or some type of imaging or something. Because I was like, your upper body's always super inflamed as well. Well, then she came back and was like, oh my God, I'm so glad that you kept telling me about that, because she found out that I had a cyst on my pituitary gland that was causing me to like, I guess, messing with my hormones and causing me to be super like swollen at the top of my body.
That's crazy. And you could tell just from feeling. That's what I mean. Someone's beat me with a wooden stick. They're not feeling that I'm like, you
I
know?
mean, it's cool because I mean, some people do use, there's a machine that I would say that you can use. It's like an endermology machine.
What is
so
that?
Basically it's like a machine. How I kind of like explain it is like negative pressure, like cupping.
It kind of like lifts rather
sucks.
than presses.
Like, it sucks. So it's like helping to like get the deeper lymph moving. Now people can use that in conjunction with hands, but like never go to someone that just uses that only, unless, I mean, you just want to go, that's fine. It's your preference.
And you really did hit at a time where the market is asking for more preventive care, for everything from healthcare companies that are sending out at-home testing kits to even the way that doctors are now positioning their services more preventive. I think you're like riding this wave, which I think is really a good wave of preventive care, looking ahead of time to see, monitoring over longer periods of time with someone who knows your body and your levels to like know when something is off. So I think it's just the perfect timing because everybody's more health conscious.
I feel like it's crazy because now everyone's really into like their health and wellness and preventative health, but it's like, I think my mind, I'm always like, it's super evolved. So I was always thinking about this years and years ago. So that's why I think I was scared to come out too, because it was like, I don't want to sound crazy.
No,
because nobody
not
was
at
caring
all.
about really like lymphatic. They're like, what is that? Like, even still to this day, people are like, what do you really do? Like, what is that for? Because some people just don't know. So I think, like, I wish I would have like just said, you know what, Jasmin, who cares about like what people think? You could just come out and just do your thing. I wish I would have started like back when like I had that idea first,
Right.
2018, 2019, but everything just plays out how it's supposed to.
It's God's timing.
So yeah.
Yeah, and it doesn't mean that that's not ahead too.
Mhm.
Someone had asked how often you should be doing this type of treatment to see or feel benefits. Do you have a general recommendation?
Honestly, if you treat your lymphatic system correctly and you're doing what you're supposed to be doing with the manual lymphatic
Right.
drainage in the whole hour session,
Mm-hmm.
you're going to see and feel the results right away.
Okay.
It may not be as much as you feel and see the next time or the third time, because I don't know exactly how bad your lymph system is, like how things are backed up.
Right.
I don't know what you've been doing to like compromise your lymph. Like, I only know what they tell me and what they put on their questionnaire sheets when they're doing all the forms.
Right.
So you see and feel the difference like right away. Like, those before and after pictures are like literally 45 minutes to an hour in between, like no gimmicks, no Photoshop or whatever.
I can attest.
But I feel like as far as like treating your lymph system and how much you should do it, your body's going to tell you, like, you know what you have going on. Like, you have to really be in tune with yourself. After the sessions, I'm always telling people like, hey, tomorrow, like, feel and like be in tune with how you wake up. Be in tune with how you go to sleep. Like, look at your body, like look at your, like everything, like it just changes, because as your lymph system now is like working a little bit better, things are detoxing from your body, then your body's not going to have the things that was housed in it from the day before, because as you're urinating and you're having the bowel movements and your body's sweating, things are like coming out, like the toxins and waste that was built up is coming out. So now you may not have so much brain fog. You may not be as tired the next morning. You may wake up with like a lot of energy, like, hey, I don't have to drink my coffee. Because that has happened to me too. Clients like, oh my gosh, I didn't have to have my morning coffee today. And I'm like, that's great, girl.
Amazing.
Just like simple things. Or like some people are like, oh my gosh, like I had the biggest poop of my life. Like I never had a bowel movement so big. Like just like things that I'm just like, okay. But it's like literally someone's life, because some people are literally out here like not having bowel movements for weeks at a time.
Crazy to me.
Some people are out here like literally living in like a fight or flight mode and like super inflamed and super can't even remember where they put their keys and like right in front of them, like because their brain fog is so bad. Some people are just out here with their lymph system just super compromised and thinking that it's normal,
right?
But it's really not normal,
right? Someone had also asked if it's safe for pregnancy. Is there a method that you can do that's safe for?
So I see like a lot of clients that are pregnant. So basically I have them wait until after the first trimester.
Okay.
Only because, you just want to make sure like everything's good and your doctor kind of like approves you. But after that, I do people during pregnancy, because it's good, because it helps to like just get all the fluid that's building up in your body, like you're moving all of that. So it helps with like just the healing and the recovery process and just making you feel like good, because your body's not housing and holding on to all that inflammation and all the things that like your body houses when you are pregnant. I just don't touch the belly at all. I just do like the face, arms, legs, everything except the belly. Don't touch the belly.
Okay. What about dry brushing, which is a sort of, I don't know, practice that a lot of people try to incorporate daily because that's something you can do at home. Do you believe in it? If you do it, how are we doing it to like activate the system properly?
I mean, I believe in it. It's just that I tell people all the time, if you're not going to be consistent with dry brushing, just don't even waste your time. If you're going to do it like super quickly, don't do it. The thing is,
how quick is too quick though?
Just
no.
Like, you know what I mean?
You gotta like comb up, right?
Slow strokes going up.
And we're going on the legs, we're going up.
Everything
on
is
the
up.
chest, we're going down from the clavicle down toward the heart. And for the tummy, are we going up?
Up.
And arms.
Everything is going back towards your heart.
Okay.
So however you do it, I mean, sometimes like even when I do like stomach areas, sometimes I'll kind of go from like, I'll kind of go here and like down and back around to like your axillary nodes, because depends on what's going on in your body. I don't want to over like make some areas like super congested. So you want to kind of like just, as long as you're going towards the heart, it's good.
Is it activating? It's probably not doing the exact same thing that a manual manipulation would do, but is it worthwhile? Is it something you do suggest?
It is, but I would say first, before you do any type of like dry brushing or anything, activate your lymph nodes. So like pump like your
Oh.
clavicle nodes, your cervical nodes, like your axillary nodes, like 5 or 10 times. Like do like a nice like pump. Because when you pump those areas, you're basically still like signaling to your body that, hey, get ready to release like or receive this fluid. You're activating.
Do that before. The little pulses before. We're doing here. I'm trying to like remember all these.
The big 6.
Okay.
Cervical,
not
clavicles.
Kylie though. We're leaving Kylie.
No. Cervical, clavicles, axillary nodes, your inguinals, popliteals, and your cisterna-chyli.
Your Kylie
All
Jenner.
6, the big 6.
Okay.
Yeah.
Okay. That's good to know. I used to do it regularly, and then it was one of those things where I lost the brush, but it was always felt like an itch that I just could never scratch. I would just sit there and like brush myself for like 5 minutes straight, and it was just really weirdly gratifying. So you can do that in tandem with.
Yeah.
What other health practices are like complementary to lymph massage? Obviously, it's a part of a healthy lifestyle in general, but like, do you hear your patients talk about maybe doing something else that really helps them feel better? Or is there a trend that you're noticing being in the health space that people are starting to gravitate toward as well?
I always tell people too, like rebounding is like a really top way to like help to activate your lymph system. Just like
jumping.
that. Yeah, the proprioceptive input that you get, it's like activating your deeper lymph. So like the rebounding, like jumping on a trampoline is good. The vibration plate kind of gives the same vibes, just less liability, the trampoline.
Yeah.
So the vibration plate is really good to activate your deeper lymphatic.
And that's how we start your massages all the time. Not massages, treatments all the time.
We do the not the lymphatic. Oh my gosh. We
The
do
shake
the
plate.
vibration plate first and then go into it.
Yeah.
Because it just helps to like move around and like kind of like just prepare your body for it.
If that's something people want to get at home too, is that what, 5 minutes a day?
Yeah,
10 minutes
a day, like 10 to 15 minutes. But it's super good. Like, yeah. I have some clients, I mean, it's a whole book with the vibration plate, but like you can use it for different things.
Okay.
But I use it for detoxing, deep lymphatic activation, blood flow, and circulation.
Okay. Every time like I do talk with a person in the health space, there's so many things I want to add to my routine that I'm like, thinking in my house where I could place all this stuff.
And then aside from that too, is just more so like anti-inflammatory diets. Because the big thing is, I feel like with the preventative space for health and wellness with the lymphatic drainage is literally like getting rid of all the inflammation out of your body. So like the inflammation is like the number one way that like diseases and diagnoses like come about. So like autoimmunes, cancers, gut issues, they all stem from inflammation in your body, because it's inflammation, like your cells are just feeding off of this inflammation time and time again.
Right.
And then over time, your body goes into a chemical imbalance, and now you have this disease and that cancer and that cancer. Like that's how they start. So if you rid your body of inflammation, you can prevent all these different diagnoses over time.
Yeah. Oh, that's interesting. You're right. I mean, when you think about everything, it does typically start with that root.
Yeah. And then, like I said, like, so anti-inflammatory things like foods, supplements, ginger, turmeric, dandelion root tea, like things that like help like detox your body. Walking. I mean, I feel like low impact anything is like really good, because I feel like as a woman, you never really know how your hormones are. So you kind of want to like make sure your body's in that rest and digest phase and not in that fight or flight. So like lower impact exercises like walking, like light Pilates, like swimming, like aerobics kind of things, very like lower impact.
Right. There's this really interesting book, and I interviewed her too a long time ago. Alyssa Vitti is her name. She has this cycle syncing method, and she talks all about like adjusting your workouts, like you said, to whatever part of your cycle you're in, because the hormones like play such a large part in how our bodies function during different times of the month.
Book Fast Like a Girl, the fasting book.
Yes, yes. Because we can't fast like men, because we have 1,000 more hormones.
That's why I always tell people, just really be in tune with your body. The things that other people do, you may not be able to do.
Right.
Just know your body and know what you can. Like, even for me, like I can't say, oh, I'm going to go on a diet and eat a salad every day, because my body, like my digestion is slow. So raw foods like house in my body, and it causes me to bloat and have like constipation and all kinds of things. But I know that I have to take a digestive enzyme to help like speed things up.
If you're going to add that in, yeah.
So I know my body. Like people need to know their bodies.
Do you do any like health, like blood labs or health testing that you have found is really helpful as well? Like, do you do a hormone panel, or do you do blood work, like to check on things? Because you're a little more tuned into the space than I think a lot of people are.
So I do go to a functional medicine doctor. I haven't really done my hormones yet, only because
you're young still.
Well, no, not even that. It's just because the doctor that I go to, he's like more so like going to the deeper root and then comes out. So he doesn't just test hormones first. He tests other things first.
Oh, wow.
And you know, sometimes it just takes time. Because
Yeah.
it's on me, though. Because sometimes I'm like, oh, I'm so busy. I'll like go in 6 months or like I'll go in like 5 months. But yeah, I feel like just getting full like blood works done, like CRP levels, because I mean, that checks for inflammation in your body, inflammatory markers, like anything about inflammation. Like you can ask your doctors for those
I didn't know
things.
there was a test for inflammation.
Yeah, just on regular like blood work, like, not even like a functional medicine, like your regular doctor, like your primary care, like when they do like your annual labs, just
Right.
ask about like inflammatory markers or something that tests like inflammation in your body, because then you're able to know like how inflamed your body is.
That's such good advice. I'm
Mm-hmm.
gonna add that.
Mm-hmm.
I talk about this a lot, but like every preventive test possible. And, I get access to things that are interesting. Like companies sometimes reach out and they're like, hey, we're doing this and that. And I am like really grateful that I did a lot of that cancer markers, blood work, MRI. I mean, like whatever. But I'm like, I think I had to like turtle back in for a minute because there is so much information you can get about your body
So much.
that it's almost like I'm good. I don't know that I want to know what like my kidneys look like right now. I
Yeah.
mean, but I do, but
Not
I
right
don't.
now.
I know. I'm like, oh my gosh.
This is too much for me right now.
It's so much.
It is very overwhelming. I
It
feel
is
like.
overwhelming, but I think we're on the cusp of, I'm hoping that we're on the cusp of a healthier several generations because we have access to this stuff and know this. Whereas in generations past, it was kind of luck of the draw. It was like whatever your family happened to do, or like you said in Brazil, traditions that happened to pass down. But beyond that, you were just kind of like, see you at my yearly physical to the doctor, if that. I mean, so I want to make sure that I didn't miss any questions. And then before we wrap, I want to, we cover this, lifestyle changes or aftercare tips.
Aftercare tips.
Yeah.
No like increased amount of caffeine, drink
Okay.
lots of water, no alcohol, because alcohol is toxic. So you don't want to put those toxins back in when you're trying to expel toxins out.
It's a carcinogen. They officially categorized it as that. I think it was the FDA or like alcohol is now officially classified as a carcinogen. So similar to cigarettes. It's wild.
Oh, wow.
So I know it like makes it less fun to go to happy hour, but I'm not a big drinker either.
Yeah.
I want to quickly talk before we wrap about sort of the healing aspect to what you do. I think it's really important when you're a person who is in close proximity to people's space, or I mean, literally like touching their skin, or hairstylists, or even like people who work in beauty with like manicures. The energy you carry as an individual is really a big factor in how great your client walks away feeling. And you are so uniquely just warm and sweet and open. I mean, professional, but like, I think you bring that to your clients too. And I know that's got to be hard because you're taking on a lot of people's stories it's like a hairdresser. Like we come in and we're like, oh my God, this and that, and this happened. So I just have to like give you credit there because that's probably a big part of the work that helps your clients feel better that isn't necessarily listed on the thing. Like, oh, I'm also a great listener, but you do a great job. Is that hard sometimes?
I feel like it is sometimes, only because we're all human, right? So it could be times that like I'm going through my own like things, but I always tell myself like, no matter what I'm going through, I always come into my space with like an energy that I want to receive, because if my energy's off and then my client's energy is off, we're just like interchanging energy. So then we're just gonna make it's gonna just be worse. You know
it's
what
gonna
I mean?
almost like bounce off of each other. It's like two north poles on a magnet, like they bounce off.
So I try to keep it at the door.
What do you do for that? Because a lot of people could benefit from, I remember having to like shed my issues when I walked into work, but it just doesn't always happen naturally. So what do you do to kind of make sure that you're in that space?
Honestly, so I'm a big believer of God. Like I'm a Christian, like we go to church. Honestly, that's it. Like I just feel like I just give it all to him. Like it's times that like, like again, we're human, we have our feelings, we feel how we feel, but honestly, I just believe that like he would never put anything like more on us than we can bear. You get what I'm saying? So when I have times I'm like literally like at my wits, like my clients would never have known. Like I'll be like, oh, 6 months ago I was going through this, and like, oh my God, Jasmin, I didn't know, because I just like give it to him, and I feel like he just, he takes care of it.
I love that.
That's just really it. Honestly, I just pray. I have to pray. Like if I don't pray, like I don't know. Like I have to just pray. Just keep talking to God.
Yeah.
Sometimes in a session, if I'm quiet and they're quiet, they're sleeping, I'm probably in my head talking to God.
I
because
love that, though.
it's some things that like
that you can't do alone.
Yeah.
Yeah.
Everything. I feel like all this is like not my work. It's literally God's work. Like I feel like God like gave me this vision. He gave me this talent. He gave it to me for a reason. Like I'm just the vessel, like doing whatever it is that he called me to do. And every day I always ask him to like show me every day, like show me if this is for me, like
Right.
let it continue to be for me. If it's not for me, then give me that sign too. Because any way it goes, like I love LymphWoRx, but like LymphWoRx isn't me. You get what I'm saying?
I so feel you on that. Yes.
Every day.
Everything. And I think like maintaining that distinction in our identities is so important. And I've had moments like that too, walking away from like a really great job. And a lot of people are like, well, I'm like, that was like never me. It's like something I loved and did.
Yes.
But I think it's a subtle boundary, but it's not easy to have. So that's so great to hear you have that. And when you live in that freedom of allowing yourself to be who you are outside of your labels, like a mom or whatever, I do feel like that's the big secret in life. Like I may be doing this or, professionally this, that's not me. It's not my essence or who I am. But when we get tied up in labels, it can almost like, I don't know, make you show up not as who you should be.
Yeah. So I always ask God, like, just if that's the case, give me the sign. Like, you know what I mean? Like, just order my steps, like lead me to like where you want me to go. Like, this is not on me. Like, so I always tell people, like, they're like, oh my gosh, like, you are so blessed. Like, you're doing like this. I'm like, no, listen, this is the Lord's work. Like, I never thought I was going to be doing lymphatic drainage. When I was in grad school, I literally was making a business plan about an indoor sensory gym for kids with autism. I was like, designing my own scrub line. Like I had none of this in my plan.
That's crazy.
But I knew that like when I went to that nursing home and I was working there and I wasn't satisfied, like that was brought to my attention. Like lymphatic drainage like came to me, like, you know what I mean?
It was
and
like
then,
a download almost. Like
and I always tell people, like, no matter where you're at in life, no matter like what opportunity comes, even if you don't like it, sometimes you got to do things that you don't want to do to actually be able to do what you really want to do, because you never know. If you didn't take that step, you wouldn't be like to the next one or to the next one. Things don't just come. It's like, I believe in delayed gratification. Like nothing's instant. Everything's like, okay, it takes time. Because even now, like everyone knows, like LymphWoRx is here. It's been in Winter Park for 3.5 years. Like it's great. Don't get me wrong. Like God is good, but I'm nowhere near like where I want to be with it.
Where
you know
do you
what I
want
mean?
to be? Tell us now.
If
you're comfortable. Sometimes people like to kind of keep it.
My thing is like, for LymphWoRx, I always had in my head, I always thought like, I know for me, like giving this, like this treatment, right? For people that know about it, it's like a luxury. Like they know about it, they do it. And it's like, okay, I can afford to do this thing. And like, I charge what I charge because of my background, because I put a lot of time and effort and money into my knowledge and into my expertise. And I give you a one-on-one treatment. It's never rushed. It's never like, oh, there's multiple people at a time. It's only me. You know what I'm saying? But for me, it's like about reaching people where they're at. So I always believed in like trying to like take money from like LymphWoRx and put it back into like my nonprofit. So I'm like getting ready to like do like a LymphWoRx foundation. So basically I want to like focus on like reaching people where they're at and like educating communities that aren't like really up to like date about like the lymphatic system and like the health and wellness and preventative health, and being able to give back to these people and like just educating them and like giving them some services and like just bringing this knowledge to them about it, because a lot of people just don't know. If you don't have it in your budget, if you're not like on TikTok or whatever, you just won't know. You know what I mean? And some people just aren't able, but not meaning that they don't need it. You know what I'm saying? So I just want to be able to give back and like bring a bigger, like just a bigger platform to like the communities who just aren't able to like have access.
I love that. So the next chapter is not just growing your brand and business, but it's reaching out. It's like
I always believe
building
that
roots.
God gives you something to be. It's not about like what you do, what he gives you, but like how you help other people. You know what I'm saying? Like, so it's like, I know that times are very hard. And I know that like, even sometimes I'm just like, Lord, like, how am I going to do this? Like, how am I going to sustain like LymphWoRx? Like my clients are like, you can't leave. And I'm just like, sometimes I'm like, you don't even know like what I have to go through to like make sure that I'm still like pressing on every single day, keeping LymphWoRx afloat. But it's just like, I know that I'm here for a reason. So I just want to be able to like have that and just give back.
That's like so wonderful to hear. And a lot of times people's goals are so self-focused that like you just kind of like startled me for a minute. You know, I've never talked to an entrepreneur who was like, what's next? And they're like, a nonprofit and like reaching out to the community. It's like, oh, well, growing and hiring 3 new therapists. But like,
It's hard to hire. Like, I feel like in this space, and I mean, I know like my clients like Jasmin, like it's literally only you. But then I say, oh, I'm gonna hire. They're like, oh, no, 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 because I want to only come to you. I feel like it's like finding that right person, like
right.
someone that's like really into it to be able to really like heal and help people and not just about the money. Because I always tell people like it's not as like it's not a glamorous like building like being an entrepreneur, building a business that like no one has. Like I think I'm like the only like real deal like lymphatic therapist in Central Florida that does lymphatic drainage on a health and wellness standpoint. There's other people that say they do lymphatic drainage. I'm not taking that from them, but when the background comes and the licensing and certifications, I am the only in Central Florida. I have people that come from Ocala, Miami, like Tampa, Gainesville. Like even now I'm traveling to Tallahassee and I built a clientele base there too. So I'm like building myself out there, but it's just me. So it's like, it's hard to find people who really want to be in this space and like really care to be in this space because a lot of times it's not about the money.
It's selfless. It's more selfless
Yeah,
than
because you get so many stories about people that you just heal and like just how they just appreciate you and how they can't like even a bad economy. They're like, Jasmin, I'm still going to put this in my budget because I cannot go without getting my lymphatic drainage. It has helped me. You have healed me
Wow.
so much. You have done so much for me. Like I have a client right now that just like literally texted me yesterday, like, had like a brain type of surgery or whatever. And even during her process when she had like this diagnosis, like she was coming to me. And then afterwards, she's just like, I can't tell you how much you've helped me. Like you've helped me heal. And like, I need to book, like now I'm clear type of thing. Like I need to get back. So it's just like hearing those stories and knowing that like nothing that I do is in vain. Like even though I may go through things and people may not feel like it's supposed to be me in the space that I'm in, like I'm here. I'm not going anywhere unless God tells me like, hey, this is done for you. But like, just knowing that like you're helping people every day and like you're actually on their healing journey with them. And like, even you put their own stuff before yours. And even if you're not being able to get poured into you, like you're able to pour into someone else, even when your cup is empty, like that's a different type of like, just, I don't know. You got to be a different type of person.
You do. And I mean, I can attest to it. Like I said, it feels healing on many levels working with you. So, wow. Well, this was so great. I'm grateful that you traveled all the way to shoot in a studio with me to share your story. For people who want to book or who want to reach out, can you tell us how to contact you?
So you can find me. You can look on Instagram. It's LymphWoRx, LymphWoRx_. And then, or you can contact me on my cell phone. It's 407-766-2846. Or we have our website, which is just lymphworx.com. So send us like a little, like a submission form or something, asking us a question.
Are you sure you want that cell phone out there?
That's fine. It's my business phone. It's fine.
Okay, I'm like,
everyone contacts
some
me
be like,
on
oh,
that.
she's cute. I'm gonna like just the business only, business inquiries only.
It's fine.
She's spoken for. Thank you for coming in.
No, thank
You're
you
a
for having
joy.
me.
You're so
Thank you.
talented at what you do. So thank
Thank
you.
you.
That is it for this episode of We Gotta Talk. I'm so grateful you guys listened. Definitely reach out to Jasmin. I'm so happy she shared her backstory here too. It's just such a joy to share with you people who like I know and can like vouch for, and she is just amazing. So the website is wegottatalk.com. Rate, review, subscribe to the podcast. Anything you can do always helps. Thank you guys again for listening, and see you next time.